there, I'm Dr. Ashanthi Gajaweera. I'm a board-certified neurologist and founder of Healthspan Neurology, and I'm so glad you're here. I'd love to introduce you to my practice and learn a little bit more about me. So I founded Healthspan Neurology earlier this year to bring a model of proactive preventive care to the neurology community in Rochester. I've been practicing within a more traditional, conventional model of care for over 25 years and felt like it was something that I really needed to do. So let me explain what that means. So our traditional, conventional model of care within an insurance-based system is very, very disease-focused. A disease or symptoms occur and then we address them. And this is absolutely appropriate. It certainly saved my life multiple times. I'm sure it saved yours too. But I do think that when it comes to neurologic disease, especially neurodegenerative diseases like dementia, we need to take action before disease takes hold. And the good news is that nearly half of dementia cases are preventable. But this is not something we are addressing within a conventional model of care because, number one, insurance doesn't pay for it. And number two, it takes time and a lot of targeted, personalized attention to know what exactly is appropriate for patients. Perhaps another reason it's not something that's standard or routine care is it's just not very sexy. It's not a flashy drug, it's not a flashy procedure, and insurance doesn't pay for those kinds of things. This is the kind of thing that takes time and attention. But that's exactly what I like to do at Healthspan Neurology, and I do that in 3 models of care. So the first is what I call the Dementia Prevention Program, and this is a 6-month model of care in which I see patients over 3 in-person visits, as well as 3 telemedicine visits. And over that time, you'll probably spend about 6 to 8 hours with me. And we go over your risk factors. We first identify them. We then stratify them. So we put them in order of what's most important. And then we find targeted ways to attack them. And for each individual, this is going to be different. And we do this by using precision medicine. So what do I mean by that? I mean imaging, I mean genetic testing sometimes when that's appropriate. I mean advanced lab diagnostics, sometimes serum biomarkers. We do this in a very comprehensive and individualized way, depending on what's appropriate for you and your needs and family background. This Dementia Preventive Program is really made for anybody and everybody, but it is targeted specifically for patients with significant concern about dementia, maybe due to family history or risk factors like diabetes or hypertension or vascular disease, as well as concussion, traumatic brain injury. So all of those are also reasons to think about the Dementia Preventive Program. The second kind of program that I do, I'm really excited about because I think it's just novel and fun and fascinating and so potentially helpful. And that is a women's brain health program that I call Mind Over Menopause. And this is a program specifically for women in their 40s, 50s, and 60s who are experiencing neurocognitive symptoms, which can include brain fog, hot flashes, mood swings, sleep disturbances. These are all menopause-related neurocognitive symptoms that can occur during the perimenopausal transition. And we've traditionally thought of menopause as just a problem, not a problem, but a change in the ovaries and hormones. But what we don't appreciate is that our brains have tons of hormone receptors and see these changes just as soon as those symptoms, those fluctuations start to occur, usually in our early 40s. And here's the thing, dementia is more than twice as likely in women than it is in men. I'm just going to say that again. Women are twice at risk of dementia as men. And changes in the brain start 20 to 30 years before a diagnosis of dementia. So if you think back, or you roll back those years, if the average age of diagnosis is in the 70s, then most women are experiencing changes in their brain starting in the 40s and 50s, which, by the way, happens to correspond with menopause. Further studies indicate that estrogen-based hormone therapy can actually improve cognition if given to women early enough during the perimenopause transition. So this is what's really motivated me to focus on menopause as well. And to do that, what I've done, in addition to my gazillion years, it feels like, as a neurologist in treating women, is I've become a Menopause Society certified practitioner, and I've taken advanced training in hormone therapy. And I feel really comfortable in understanding the pros and cons and delivering a patient-centered approach and shared decision-making with patients about what's best for them, whether that's hormone therapy or other modes of treatment. And then the third thing I do is just standard routine neurologic consultation. So what do I mean by that? I'm a nerdy neurologist. I love working with patients in terms of movement disorders, migraine, epilepsy, stroke. It's just not something I can stop doing. It's just the way I view the world. I see the world as a neurologist, and I really enjoy working with patients with neurologic symptoms and helping them with their diagnostic plan as well as their treatment plan. I try to do that within 1, 2, or 3 visits to give you a framework on how to move forward within that diagnosis. And then I try to liaison you with a provider within the community to have good continuity of care. Now, what most patients say to me is they love what I do, they'd love to sign up to work with me, but they're worried that I am a direct care provider. So let me explain to you what that means. Being a direct care fee-for-service provider means I do not take insurance. So when you come to see me, you pay me for the time that we spend together, and I personally do not submit that to insurance or Medicare or TRICARE or workers' comp or no fault. This allows me to focus on what's important to me, which is your care. Now, I understand that this is not always possible for everyone. So what I am able to do is, for most patients, I give you a receipt, which is called a superbill. It includes your CPT and diagnostic codes, which are just fancy ways of saying what insurance needs to pay. And then you can submit this for out-of-network reimbursement. I cannot guarantee this in any way, but many patients have told me that this has been effective and helpful for them. My pricing and policies are transparently listed on my website, and I invite you to look at my website, learn more about me, learn more about my services, as well as how my process works. And finally, if you are interested in learning more about whether we're the right fit, the next step for you would be to go on my website and schedule a free introductory call. It's really easy to do, and I would then talk to you for about 20 minutes. We talk about what you're looking for. I talk to you a little bit more about how my practice works. And my goal is really that we are the right fit. If I don't think that I have the skill set to be able to help you most effectively, I'm going to tell you that, and maybe advise you on where else you might be able to go. I can't give you any medical advice during that call, but I really do try to do my best to help people and nudge you in the right direction. The other things about working with me that are, I think, really unique and different from most providers, and there's many, but let me just tell you a few. One, I think I'm super, so you get to work with me. Number two, I get to take time. So, my new patient visit, which is a fixed fee, I usually spend an hour and a half with patients, if not more. And I think that's important because it's your neurologic health. There's really nothing scarier or more concerning. So I really want to take time, get to know you, and make sure we're doing everything we can to optimize your health. And then number two, I can get people in quickly. I don't have a busy practice. I don't want to have too busy of a practice. So I see patients within the next 2 weeks usually. And when you call or email, you actually speak to me for the most part, and I try to get back to you within 48 hours. So there's not this phone tag that you're dealing with a bunch of office staff and needing to press a bunch of buttons to leave messages that nobody's listening to. And then number 3 is that I prioritize your health and well-being. My job is not to check off insurance boxes and make sure that I'm doing what insurance wants to do. My job is to make sure I do what is best for you. So when I order tests, I'm not thinking, am I going to get dinged by insurance? Do I have the right code for this? Well, sometimes I need to think if I have the right code for it so that insurance pays for your testing, but I don't worry about how that's going to affect my standing with the insurance company. Because guess what? I'm already out of network. I'm not participating with them. So that means that they can't smack me on the wrist for not doing what they want me to do. And number 4, a lot of patients worry that their testing is not going to be covered. But here's the thing, I'm a New York licensed board certified neurologist, and I am able to order the testing that's needed from local providers to be paid for by your insurance. And I help you as much as I can while getting insurance authorization so that you feel comfortable and secure that knowing that that testing is going to be paid for before you have it completed. In the rare cases like genetic testing or serum biomarker testing that we know that that's not going to be covered, I am able to give you an estimate of what that's going to cost because I'm not the one charging you for that. That's going to come from a third-party certified lab. So what I'm trying to get at is I try to do my best to provide an excellent model of care. I love being a neurologist. It's something I dream about. And in terms of the way I go about my world, the way I think is as a neurologist. And it's something that working in this capacity of founding Healthspan Neurology, I'm just so grateful for the community to allow me to be able to do this. And I hope I get the opportunity to work with you as well. Bye-bye.